The Neil Hann Award was established in 2017. Its purpose is to recognize community leaders who have demonstrated excellent skills in leadership, innovation, and inspiration. This year's recipient of the 2021 Neil Hann Award is Sharonda Givens of Tabitha Baptist Church in Oklahoma City.
I would describe Sharonda as a go-getter, a person that's very organized and strategic in what she does, and dedicated and committed.
Same thing. She knows what she wants, and when she decides a path to get there, she will take it and get there, no matter what. So she's very driven and very, as her mom says, very organized. So she's a driven, organized person that wants the best for everybody.
She's very, very knowledgeable, very helpful. She seems to have a real concern about what's going on in terms of the community, and wanting to try and get as many people tested and vaccinated as possible. So she seems to be doing a pretty good job at it, and she's pleasant to work with. So that's worked out well for us.
It was not supposed to be my project. It was supposed to be my mom's project. And so she had something to do, and she wanted me to get on the call with Laura. And so I did. I'm fortunate to have flexible hours with my job, so I was able to get on there. And after listening to the mission and the goal, what was needed and what they were looking for, the task, what she was dealing with right now, she was unable to kind of do the task. So I just took on the task and said, okay, I'll do it. And I just took the bull by the horns and ran with it and been going ever since. So
One of the things about Sharonda is that she's a sharing person. If she has something that she feels like will benefit someone else, she's willing to share it. And also, she's concerned about the community, always has been since she was a little girl, and so she will seek out places to be helpful in this, what we've been doing with the COVID. I mean, it's just been amazing the things that she's done to impact this community with what we are able to do with the help of Public Health Institute.
She's always been concerned about helping and giving back, and this has allowed her the opportunity to do so at a very critical time in the life of the community and even our church. And so she's been able to give back in ways that help to show what her faith is, because she is a lady of faith. She's a woman of faith. And she acts upon that faith, and she acts by giving back to those that are less fortunate. Always been that type of person.
of course, I want to give a shout out to Public Health Institute for even allowing us this opportunity. Without them, this wouldn't be possible. I want to thank the University of Oklahoma Health Science Center, Dr. Tim, Brittany, all of those who work diligently of keeping us aware and keeping us knowledgeable of what's going on, the research that they're doing. I ask a lot of questions, and I know they're like, oh, Sharonda, nobody's asking these questions. But I love asking, I love picking their brains. And they have taught me so much as it relates to COVID, and I'm able to inform our community of these things and actually encourage them more. And it's actually brought more people out with that knowledge that they've given me. I'm able to kind of educate a little more instead of say, hey, just come get a COVID test. And they're like, well, why? Well, because you just need a COVID test. Well, no, Dr. Tim and Brittany at OU have educated me enough to let them know, inform them of the importance and the effects of the Ys, the antibodies, and all of those things. I also want to give a shout out to my church family and thank them for trusting me to do the work. It's a lot, but like I said, I'm flexible. I want to thank all my nurses, Sharika Fields, Marisha Dawson, Linda Branch, Carla Smith. I want to thank those ladies because they do take out the time. They are licensed, registered nurses, nurse practitioners, and they take out the time out of their day, their daily schedules, their own jobs to come out and assist me when necessary. And then, of course, our volunteers here at Tabitha. This is a job that needs to be done. So I just feel like I'm just doing what I'm supposed to be doing. I appreciate being recognized, of course, you know that always feels good, and it's always affirmation that you're doing the work. So I appreciate it because it just confirms that the work is being done and I'm doing the work. So thanks.
Welcome to the 2021 Community Health Champion Awards, sponsored by the Oklahoma Turning Point Council. Our first Community Health Champion is Tabitha Baptist Church, connecting generations to God.
Our mission is to connect generations to God, one life at a time. And so that is what our pastor envisions for us. No matter what your age is, you can connect to God. And so we always look for opportunities. We seek out opportunities to be a blessing in our community. Because if we you got to meet the basic needs of people before you can even introduce them to Christ. If they're hurting or if they're ill and they can't know God until they have been helped in those areas. It impacted our community hard. We have so many of the high-risk things going on in our community: type 2 diabetes, hypertension, age, obesity. And so those are some critical factors that were impacting those who received or got COVID. And so certainly, since we know that, because in the Northeast community, those rates are alarming. And so we definitely wanted to have the opportunity to test. And the way when you test, then of course that's how you know if you have it and know what to do to prevent getting it and how to prevent the spread, which is what we wanted to do. We wanted to make sure that in this community we did what we could do to prevent the spread of COVID-19. There's a gentleman, whenever he sees us out here, he drives up looking for Sharonda to get the COVID test. And so I'm just thinking, he looks for us as his source to make sure that he is not transmitting or contracting or have COVID-19. The resources that were offered by the Public Health Institute, that's what made it a success for us. And we're so grateful and thankful for the opportunity to partner with them.
And the volunteers who gave of themselves and their time. And again, it goes back to the care for the community, whatever we could do, especially as a church, not even just the community, even what it meant for our church, because we've had people inside of our church who's been impacted as well. And these services offered have been able to help many of them in the awareness and the education and the checking and rechecking, and just the fact that they know that we are doing this, that helps a lot. It helps so that if they need that service, they know that we are providing that service to the community. So it helps inside the church and outside of the church.
And since we've been able to do this, we don't think that anyone that we know of, we put it like that, has been hospitalized or passed away because of COVID. Our hope is that as we continue to do this, that we continue to keep the community safe. That's what our hope is, that no one in this community suffers from COVID. That's our hope. In the future to come, we don't want anyone, because we know new variants are coming out. And so that's why it's critical that testing be done regularly, especially with kids not being able to get the vaccine. And there's a lot of kids in this community, and they can come here and get tested so that we can make sure, and even their family members, so that we can make sure, so in the future, just to make sure that we're here and available to test.
Our next community health champion is the YMCA of Greater OKC Family Resource Centers.
I think what makes me passionate about this work is just the impact that the Y has on kids and families. And over this last year, the opportunity to really support families in a lot of new ways. Just really meeting families where they were in the community, a place where families felt safe coming and wanted to have their children involved in activities.
When everything shut down in March of 2020, we knew that there was still going to be a really high need for childcare. And for anyone who's done YMCA childcare programs, we love what we do. We're passionate about making sure that kids have a safe space to be. And so when everyone else was shutting down, we actually opened our doors back up and we provided emergency childcare for medical personnel and first responders so that they could continue to go to work and do the important work of caring for our communities and caring for our society.
We've definitely had every curveball thrown at us. For our programming, for our fitness centers, for our child care program, our school age programs, you name it. There was a curveball given to us, but we have persevered. We see ourselves coming out of that. Our services continue to be at a high need, and we were able to continue to offer those services at a high level. I think our organization did a great job of adjusting to the challenges that were presented to us.
My program is not typically something that offers all-day care every day of the year, but when the pandemic started, we did.
That allowed us to open our doors to our community who had possibly never been in our programs before. We provided care to people who had never stepped foot in our doors, who didn't even know that the Y had a child development center, but they entrusted us with their children without even coming into the building, and I think that's a lot of because of what the YMCA stands for. They knew their children would be safe. They knew the quality of standards were high. And so for those 8 weeks, we were able to cater specifically to essential workers and have been able to keep some of those families with us beyond that time and have continued providing care. And I think during that time, we really saw the high need for our service that we provide, and even in the midst of the pandemic at its peak, we were still able to provide care for those that needed it.
The Y has really kind of been that throughout our history, but I just think the Family Resource Center model, what makes it so special is the way we bring about partners so that families have access to all of the services. The Y is already a place where they feel safe and want to be, but there's no social stigma attached to all of these other services that they may need, whether that's help with food access or mental health access, any of the other services that they might need from the state that they can access. So the Community Hope Center model that we've been working in for the last year has really been tremendous in really helping families access all of those other supports that they needed during that time.
We are definitely continuing to grow our partnerships and we're looking at other agencies that we can work with to address mental health needs. We know that this last year has been really difficult for a lot of people, and so we're trying to find ways that we can both encourage our staff and also our participants and members to look at the whole body. As I said, we're all about healthy spirit, mind, and body. So the ways that we focus on our healthy bodies, we've been doing that for a long time, over 130 years here in Oklahoma City. And so now we're moving into how do we help people grow and have healthy mental health and to be the best that they can be in all areas of life.
Well, we are very honored that the Oklahoma Turning Point Council would recognize our efforts in this way. And we're excited to accept this honor on behalf of all of our partners. We could not have done everything that we did in the last year without all of our community partners, whether the United Way, Oklahoma State Department of Education, Oklahoma Department of Human Services, the Regional Food Bank, all of our local public school districts, the City County Health Department, all of them rallied together to meet a lot of different needs in a lot of different ways. And that's really what defines a family resource center. It's bringing all of those resources together to better meet the needs of the families. And the Y was happy to be a partner in that and delivering those services.
On behalf of the Oklahoma Turning Point Council, we name you as a community health champion and thank you for all the work that you do.
Thank you.
Thank you.
Our next community health champion is the Texas County Coalition in Guyman.
We're the center county of the Panhandle, the right in the middle. We're probably the hub for the Panhandle of support, but Texas County, we utilize Kansas and Texas as easier than we do Oklahoma. So our demographic are pretty independent. They try to get their own needs met without asking anybody for support. We have a very diverse population because of our pork processing plant. And
We're one of the most culturally diverse counties in the state of Oklahoma.
We began in 1991. We were actually the Turning Point grant, the original Turning Point grant. And so then we've just continued to organize, promote, meet since 1991. Texas County always has its unique challenges because of our distance from the state. Our IT is different than Metro IT. We had quite a few barriers in that pilot program, but I think it taught us all less, about how to overcome some of those barriers when you're in rural areas. Platforms are kind of new to me, and I understand their benefit. And we had the opportunity to experience it and run the pilot.
So MTX is the electronic platform that we originally tested for the state to cover the COVID testing event, the catch-up event.
Yes.
So that platform allowed us to have ease of entering the patient's information and testing. It helps coordinate easier in electronic format. So the whole environment and has changed around, and especially here in Texas County. We are one of the rural areas, so we're not in an urban area. We don't have as many people here. There's not as much traffic. So the virus numbers are not as high as you would see in a larger urban area. So that leads our community to feel like it's not as much of a needed.
Our community isn't as scared.
Yeah.
I mean, it's unfortunate, but I mean, it's the attitudes here are different, and we are, even though we have a pork processing plant, we have had really high numbers. Texas County has been, but people, I think our general average population, those ones that have been here forever, don't think it's their problem, right? It's a problem of somebody else. It's the people working in the plant, or it's the people that can't get health care, or it's the, and so there's real, I don't know, maybe other people in the state are, but it feels like we're defending or trying to impact attitudes as much as we are about healthcare and about COVID testing, and which is what the coalition is, right? We impact attitudes all the time, or we try to impact attitudes all the time. But
so the education piece with COVID has turned out to be one of the more important things that we can offer to the community. Not just the testing, but the actual education and information behind it, and why it's important, and why, even though they do feel like we're an isolated rural area, that it's still an important piece for our area.
I believe in grassroots organizations. I believe that our community should have a voice and direct the money that comes into Texas County. For years, people in Texas County, we felt kind of out here left alone. not supported by our state, and things that work in Texas County don't work the same in Tulsa County, in Oklahoma County. And so this is our way to have a voice, to direct the funds that are coming down from the state and federal levels to make an impact on how it makes sense in Texas County. And that's why I have stayed, and that's why I do what we do, because it feels like a way to make it make sense in Texas County.
We're not just here to do COVID testing. We've been here for a long time, and we're going to continue to be here to help improve the healthcare of Texas County for all of our residents. So that's one of the main things that we're so excited and so happy to be a part of this, and to be awarded. It's wonderful that somebody can recognize our drive to improve healthcare in our area. We're currently working on a mental health improvement project, so we're hoping to have some movement in that area here in Texas County. So I think it's just continue to see what opportunities arise and what areas really develop for us. There's going to be areas that improve, and there's going to be areas that we're going to see that need improvement. And I don't think that, I think it's something that we just can't stop on. We're just going to have to continue to develop this area and push and strive towards the goal for us.
The next community health champion is Muskogee Bridges Out of Poverty, empowering low-income families to radically change their lives by discovering and overcoming barriers to success.
Bridges Out of Poverty is a community-wide collective and community initiative, and our job is to address generational poverty. And we do that several ways. We have graduated over 450 families from the Getting Ahead and Just Getting By World classes over the last 10 years. And we have trained over 3,000 of our community members and business community in the complexities of poverty.
Before I was in the Bridges class, I was in the middle of a DHS case. I didn't have a job, was looking for a job. I was just coming out of a season where I was using alcohol to deal with my problems. So I was just really had to give just a blank canvas. I didn't have really a whole lot going on. Didn't have a whole lot of hope for what was going to happen, and I got accepted into the Bridges class, and I was just kind of stuck in my ways. And so throughout the 21 weeks of the classes, I was set at the table with some different people that were of middle class or even wealth class, and some ideas started to spark in my head about maybe the tot and the things that I learned growing up and into adulthood weren't really working for me. And so Bridges was able to teach me some concepts about my community, my resources, my budget, my family, what kind of job I really wanted to do, where I wanted to be in life, and just the community family of inside Bridges meeting once a week and just having those cheerleaders on my team to make things come alive, learning about networking and social capital, and just meeting new people at new tables and being able to talk about the people in poverty and the problems that they have. And having people in the wealth classes listen to those, and then we all work together to try to create solutions for our community about that.
I am one of the luckiest people in the world to get to do the work that we do. I grew up in generational poverty, and when I first learned about Bridges Out of Poverty and the constructs, it made my head spin. It gave me a vocabulary to explain my past and a way to articulate what I've experienced. And so I used that knowledge, and before this I was the president of the Muskogee Chamber of Commerce, and I brought all those relationships with me to this job, and all of those things together have just been an amazing way for me to be effective at this job, and I've never been more fulfilled in my life. This job makes my heart sing. Of course, the past year has been challenging with the pandemic, but it has been very successful. We were able to pivot and transition into virtual classes, and they went very well. And so we've had a really good turnout in our classes, and more importantly, the outcomes that we're getting in helping families is amazing.
Muskogee has a poverty rate of 20%. So that means 20% of our population is struggling to meet needs of everyday life. We're living in the tyranny of the moment, which is we're just solving problems as soon as they come to us. And so we can reach out to our community and have workshops. We can help other moms say, hey, you know, Bridges taught me these tools, but now I'm in a workplace, in a work environment with people that are also pretty much have lost things, and so they're a blank canvas too. So it's a very big ripple effect that Bridges has, because each person that's in those classes, if I have a family of 3, my family of 3, the ripple effect, each person is going to go out and teach 3 more people the same thing. So now you've got 9 people, and so you take those 9 and those 9 teach 9 other people. It's really biblical about how if you can, our resources in Muskogee can give people things every day. They can give people, you know, help with their rent, help with their bills, utilities. You know, a lot of programs they like food bags or things like that. But do we really sit down with the people and say, how do we keep you from coming back to these resources? You know, and if we go back to those resources, it's as volunteers to help, or we're bringing extra food to those resources. But fishers of men, teaching a man to fish, that is what's going to change somebody's life. That is what is going to change our community and lower that poverty number for our community.
We're so excited and thankful for the opportunity to be recognized by the Turning Point Council, and excited. Thank you so much for this opportunity. So in the future, we are looking at creating a leadership program for our graduates. We already offer staying ahead classes for them right now in the form of money management class, boundaries class, and parent university. We want to start a leadership program to help people know how to serve on boards across the community. My ultimate goal would be to have every nonprofit in this town have a position available for a getting ahead graduate to serve on their board. Our graduates have been told that they are the problem their whole lives, and people in poverty hear that all the time. But after they go through our Getting Ahead class, they don't want to be the problem, they want to be part of the solution, and no one's asking them to help. So I want to change that, and I want to give our graduates the opportunities in this community to be a part of the solution.
We're just working to help people out of poverty. I mean, being able to give back in that way is one of the best things in my life.
Our last, but certainly not least, community health champion is the Mays County Hope for Youth Impact Council.
I've seen a lot of my friends from elementary school go down the path of drug and alcohol abuse, and I don't want to see that happen to everyone, and if I can do something about it personally, I want to do that.
Because I have lots of friends in high school and lots of family members that have struggled with mental health, struggled with substance abuse, and it's just really important to me to try to teach others about that so it doesn't happen to others like it's happened to people I've known, and also just for myself too, and educate myself. So a little bit about Hope for Youth. It's a nonprofit organization in Pryor that focuses on substance abuse, mainly in youth, but also in the rest of the community. And Impact Council is really where it's youth oriented. We love to focus on like the schools and stuff, substance abuse prevention and awareness, and we've also shifted a little bit into mental health awareness this year at our schools. Like this month is Suicide Prevention Awareness and Suicide Prevention and Awareness Month, and we've really been focusing on our students' mental health, and we're actually working on that today, working on a few projects for that, like we're showing the PSA, and we're doing a few posters, and we're putting up magnets all over the lockers. So that's really our focus this month, but it's really what we're all about.
We've really stepped in more the past few years and have really like gotten out there and talked to the kids a little bit more.
I mean, I see how it could affect and how it does affect community, because even this last week we've had, I think, 2 overdoses in our school, both requiring ambulances to come and take the kids out.
We have targeted quite a few kids. I think our numbers are going down, and our school-wide and everything.
So we actually have taken surveys. We take surveys every 2 years, and one of the questions on the survey was like, how bad do you think, it was to the students, to sophomores and 8th graders, I believe. It was like, how bad do you think using tobacco or drinking alcohol is 1 to 2 times a day? And the first one we did, and I forgot what year it was quite a back year, so maybe 2017. And we saw a 5% increase in students that thought it had a negative effect. Then the surveys were about 2 years apart, and the most recent one had about a 5% increase in students who thought tobacco was negative, and about a 9.2 increase in students who thought alcohol use was negative. So that was a really big thing for us, because the numbers were pretty low in that first survey. And also just around the high school, we see a lot more students getting involved in things like student council, leadership activities. Just everywhere in the high school I'm seeing more and more clubs, more and more things that emphasize positivity. And just since my freshman year to now, it's much more student involvedness and stuff.
I mean, it's been hard with COVID and stuff because we haven't been able to do all the stuff that we normally do. So that has limited down this last year. But before that, I've seen that because like we do the student of the month, so like you'd walk down the hall and you'd see and people like, oh, student of the month, and they knew that was from us and what we stood for. And I think that it really has made a difference. And my only thing is I think it's made a small dent in a big load.
Well, I think the thing that really makes Impact Council work is all the time and dedication that everyone puts in and all the hard work. So I think it really pays off when we all work hard.
I was at a cross-country meet the other day, and our principal at Prairie High School came to watch, and he pulled me aside, and he was like, I just want to let you know that what you're doing right now at the high school and the junior high and the community, it is having a good effect. And I'm really proud of you guys, because being here a couple years, because he's only been principal since I was a freshman, I think. And he said he's seen a lot of change in the schools and the community just by what we're doing. And he kind of told me, like, just push it further, keep going. So that really meant a lot to me, because I was like, so even the principal is seeing a change. And he sees everything, so that meant a lot.
As a representative for the Oklahoma Turning Point Council, I'd like to name you as a 2021 Community Health Champion, and thank you for all the work for helping your community. Congratulations to the 2021 Community Health Champions.